I am a neuromodulation specialist at NeuraXis Care and Research Center. I am the Director and Chief Operating Officer for Neuromodulation Therapies at NeuraXis. What we do in NeuraXis, it's called as a neuromodulation therapies. What is neuromodulation therapies? Neuromodulation therapies, it's a combination of selective surgeries with rewiring the nerves with a specific electrical impulses of the nerves. Either it can be on brain or it can be on spinal cord, and it could be on any other places, various peripheral nerves. So today let's discuss on the deep brain stimulations. Like many places, many people they know about it. What is deep brain stimulations? So deep brain stimulations is like inside a brain we put two electrodes and we put a pacemaker. Like how we put the pacemaker for the heart. It's same thing. It's a pacemaker for the brain. Why we do this? We do for the patient who has a Parkinson's disease, the patient who has dystonia, the patient with essential tremors, the patient who has epilepsy, the patient who is suffering with treatment-resistant depressions, treatment-resistant obsessive compulsive disorders, and lately it's US FDA they approved for deep brain stimulations for Alzheimer's disease or dementia. But every patient is different, so it needs first proper selection of the patient. It's a teamwork selectively for these neuromodulation therapies. It's a teamwork between neurosurgeons, neurologists, and neuromodulation specialists. Neurosurgeons has their own role to do a particular things, and they have to they do it such a way it called as a functional neuromodulation, like functional neurosurgery and stereotactic neurosurgery. Now the most important thing in deep brain stimulation, like first the planning. It comes like when the patient comes for the surgery, how we are doing the planning. So that's most important, the planning of the electrodes, how we are going to put the electrodes inside the brain. Then it comes to the on-table assessment, how we are stimulating and how we are finding the good effects and the bad effects. Third part comes after the surgery, everything start the programming of the device. So this programming, it's very complicated, because it's not so easy. Each patient is different, and the programming pattern also for particular patients has a different way to structure it. It has amplitude, it has pulse width, it has frequencies. So patient who has a Parkinson's disease, they require different pulse width, frequencies and amplitude. Patient who has a dystonia, they require different pulse width, frequencies, and patient who has epilepsy and other symptoms, they will require different ways. So when you choose a center for deep brain stimulations for these symptoms, you should find out the center should have a proper functional neurosurgeon, proper neurologist, movement disorder specialist, or the psychiatrist, and the neuromodulation specialist, because it's a teamwork. Together we do, and the work we do, the places they do together, and the results also, it's like it can improve the patient's quality of life 80 to 90%. Yes, it's also true, we cannot cure Parkinson's disease, we cannot cure dystonia, we cannot cure epilepsy, but yes, we can control it. We can control essential tremors, we can control Parkinson's disease, we can control the dystonias with a proper way of programming, medication adjustment, and also the most important, proper way how you have done the surgery. So that's most important. So don't be afraid of this deep brain stimulation. It looks very big things that yes, we are going to do something with the brain, but yes, it's completely guided with the navigations protocol. We completely have a team of people, team of doctors. They do the planning and put the electrodes and everything. And half of the surgery it's done by local anesthesia. So usually patients, when they perform the surgeries and all-table assessments, patient usually they talk to the doctors. And when it comes to the battery placement, that time only for half an hour we put the general anesthesia, and then next day onwards we start the device programming. And first 3 months it requires patients to visit to a neuromodulation specialist often, like every week, every 3 weeks or months. After that, as and when required, and the medication adjustment also starts on that time itself. So don't be afraid of these deep brain stimulations. When we have a problem, we should fight together, we should stand together, we should hold hand together. So let's join hands on the NeuraXis Care and Research Center, and let's fight together against the Parkinson's, dystonias, epilepsies and essential tremors. we are together here. We are the people who are working together to give this kind of specific therapies to the patients who need this therapy to improve their quality of life. Thank you.